This peptide is like, the furnace that actually burns down, all our fat cells, and it causes our body to actually go into thermogenesis. That's why they call it exercise in a bottle.
Good morning and good evening to wherever people will be listening to us from. And we are here again, me, Dr. Sophia Din, and my friend and colleague, Dr. Robert Frankel. And today we are here to continue our discussions on peptides and to learn new and reliable information about their usage and their potential interactions with other medications and how we can utilize this new form of medication in medicine and in wellness industry generally. So welcome, Dr. Franco. So happy to have you again. And let's see, what are you teaching us today? I'm in
Okay.
Dr. Frankel's class.
Well, it's good
I
to
look
see you.
forward to this class more than
Yes, it's a
more
good
than some
class.
other
It's a fun
classes
class.
that I have.
There's no big exams at the end, but yes, it's a good class, and
Actually, we should have
we
questions
should we
and
should.
exam at the end, and we should get this. Like people who attend this should get CMEs.
Yeah, CMEs, they can do, we can, if we can give discounts on peptides if they answer all the questions right.
Oh yeah, yeah,
I write a
exactly.
pretty, I write a pretty, hard exam, so I'll see what they do. But yes, it'll be fun. Yeah, so it's great to be back again, of course. I'm excited to be here. I was traveling a little bit, so we missed a couple of weeks, but back. We're definitely excited to talk about today's topic because I think it's a really important topic because in the anti-aging field, as well as just the general health field, I think that this topic is going to be one of the most interesting and exciting ones. So thanks for having me back.
So let's start.
So this basically is talks about like we'll go through the topic and how the mitochondria, which is a big word, and people have heard about it. People have, bandied about it. A lot of people don't understand it. So I'm gonna talk about it and I'll talk about how the mitochondria, which is within a cell, really has the keys to our aging and the fact that we are going to work on how we prevent aging, help a lot of the major diseases that we have by just like focusing on this little organelle in the cell called the mitochondria. So the mitochondria, I'll just go I'm going to go a little into the weeds just for a few minutes, just because it's kind of it's interesting to me. Maybe it won't be interesting to the rest of the topic, but I think it's kind of interesting. The mitochondria actually is a bacteria that, when we were first developing, were devoured by the cells. And so what's interesting about that is that it's a cell within a cell. And we don't have like one mitochondria in our cells. In many cells, we have thousands of mitochondria. And why are these mitochondria important? Well, because everything that we do, every move that we make, every thought that we have, every heartbeat, every time that, we have the immune function working, every time a cell divides, it needs energy. And where does that energy come from? And that energy comes from these little organelles called mitochondria. So if without mitochondria, you will absolutely 100% die. And how do we know that? Because if you give the one thing that actually just makes mitochondria dysfunction, cyanide, it kills you within 30 seconds. So that is the fact. And the fact that as we age, our mitochondria not only become less, but they become dysfunctional. And this dysfunction actually causes a lot of problems in our body. So I'm going to talk about what those three things that it does and how that equates to us aging, us getting sicker, and us not being as well, and how we can kind of help to reverse that, and the things that we can do to reverse that. So there are three things that I'm going to talk about when the mitochondria start to not only decrease in amount, because we lose probably about 50% of our mitochondria by the time that we're 50, but also what happens is they become dysfunctional and they don't work as well. So the first thing is the energy, ATP, that we are produced by the mitochondria becomes much less. And so I always talk about this, like your 2 o'clock in the afternoon, like crashing has to do with the fact that we don't have as much energy as we were when we were younger, because of the fact that our ATP are not being produced as well. The second thing that it does is it actually takes cells and it actually causes the cells, if they are non-functional, to die. And if this doesn't work well, it actually causes something called senescent or zombie cells. And these zombie cells actually, as we age, can get up to 40% of parts of the body. And especially people think about these in the skin because of the fact that these are cells that are there, that are not dividing, and all they are doing is causing inflammation and not allowing new cells to actually come in and divide and actually grow with new growth factors, with new stem cells. So all these cells are just sitting there, and this has a lot to do with how our skin is being affected by the fact that we are aging and having mitochondrial dysfunction. And the third thing that it does, which you've heard a lot, probably heard a lot about, but don't really understand, is that when mitochondria don't function properly, they cause these things, they produce these things called reactive oxygen species, which I'm sure you've heard if you ever have taken a single vitamin in your life, free radicals. And free radicals are actually cause toxic and damaging parts to all the cells. They cause mutations in the DNA, and they actually cause a lot of the aging as well. So, in these three factors, mitochondria really has the keys to our aging, and being able to kind of reverse it are really important. So, the first
So
thing
let
is
me
lack. Go ahead. Go ahead.
So I wanted to, just have a quick recap of this because I know
Sure.
you throw so many things at the same time. So I know like mitochondria are the energy factories inside our each cell of ours, and these are the energy producers for whatever we do. So whatever we think, even a thought that comes through the brain has to activate some mitochondrial action inside our body, right? Is that
Correct.
that is number one, and
That's
then
100%. Yep.
and then this is the first time I'm realizing that this is a bacteria. It's like a
Yeah.
bacteria inside
Yes.
of our cell, which is like perhaps a bacteria itself that is,
Mhm.
floating inside us. And one amazing thing I love about mitochondria is that there are s- like hundreds and thousands of bacteria, mitochondria in just one cell. One single cell
Right.
has like such a big like these are factory upon factory of energy production in just one cell. So,
Correct.
and the third thing that I love about my mitochondria is that mitochondria, it's a maternal gift. So
Yes.
if
Yes. I
your
was going to
mother is
mention that.
lazy, you are going to be lazy because it's a maternal gift. And it's a lineage. It carries so much genetic material that
Yes.
is like, one of the reasons that science has proved that civilizations who knew that mothers play an important role in the transmission of genetic material were
Absolutely.
correct. We are finding it that they were the ones who were right. Not that fathers are not important, but
Of
they're just
course.
the
Of course.
unlockers of the genetic code in the mother. That's really all as far as humans is concerned.
That's
Um,
correct.
And then aging, and then you went down to whatever ages your mitochondria is going to cause aging. So now you're telling what are the things that it does and how many different ways that a mitochondria gets, loses its youth.
Right.
And I don't like. Can you explain the zombie cells because that was like
Yes,
that
yes.
really stood out, and then
Yes,
ROS,
zombie.
that is like again another the free radicals,
Yes,
how it produces the free radicals, and is this all intracellular? We're currently
yes,
just focusing on one cell,
correct. This
one
is all.
mitochondria, one cell.
This is one, yes, one mitochondria. I mean, obviously, if a lot of them will have the same kind of fate where they start to dysfunction, and this causes a large production of these problems within the body because of that. But yeah, the second thing that it does, normally, it causes something called atopy, which means that it actually kills cells that need to die. So there gets to the point where certain cells like get to that point. They need to kind of move on, go to the dark side because they are non-functional. So when this happens, if the mitochondria are not functioning properly, it causes the atopy not to occur. And so when that happens, it causes these cells called senescent cells. What these cells are cells that literally do not divide. They don't do anything, but they do one thing. They produce inflammatory markers that are actually toxic to the rest of the body, and they are creating this whole brew of system where they increase, inflammatory IL-6, TKA alpha, all these inflammatory cells, which obviously are negative. But the other thing that they do is that you think about it like if you had like a basket of fruit and one piece of fruit goes bad, it's like sits there and goes bad, and all the other fruit, seems fine. These senescent cells start to affect the other cells around them and cause them to have the same kind of toxic effects on the rest of the body. So they are actually, I mean, their initial kind of function is that sometimes the body kind of triggers these senescent cells to occur because they find that there might be something wrong with the cell, so they don't want them to divide. So it's kind of a natural body's way to kind of prevent cancer cells from growing. But
Mm.
when these senescent cells actually are present and they are not, like abnormal cells and they're not dividing, they are just sitting there and they're causing these toxic brews. So we talk about in the skin specifically how, the senescent cells really cause hyperpigmentation, they cause, decreased elasticity, and they don't allow our bodies to actually affect the normal growth factors, and their normal stem cells. Like they don't let the new cells come in. Like we know that, just in the skin itself. I mean, there's lots of different parts of the body that this occurs, but I'm going to focus on the skin because it's easy to think about. Like we know that every 28 days we have a natural kind of progression of cells dying, new cells coming in. But if a lot of those cells are actually senescent, they can't do that. They can't turn over. And that's what causes a lot of aging in the skin. That causes the thinner skin, less elastic skin. So this really is a big part of, like aging in that point. So that's what the senescent zombie cells are.
You
They're
know, I have a comment to make on this that,
sure.
as you're saying, senescent cells, so this is basically the medical grade way of saying that it's an old cell. It's a geriatric
It's
cell.
an old
It's an
cell that
old
does nothing.
geriatric cell
Yes,
which is in a
exactly.
bad mood. It's releasing toxic
Yes, yes,
chemicals,
yes. It's
and
perfect.
this is like aging. So what it's saying is that when you have like these aging cells promote more aging around them. So
Right,
it's like
exactly.
aging itself as if it's a disease that creates these inflammatory markers, and then other cells that are next to it get affected and impacted by the produce that is the production of whatever they are producing.
Right.
So wow, that's like another moment. So if they are if you have aging parts of your skin, it can lead to more aging. So aging can lead to
Yes.
more aging. So
Correct.
anti-aging's got to be like at every, you got to like protect. This is like wow.
This is
First
like on a
defense.
cellular level, yeah.
At a
And the
cellular
way
level, this war is happening.
yes, and the way I thought about it actually yesterday too, like I liked your thought on how what you said, but the way I thought about it is like cancer cells are like these abnormal cells that keep growing, and that's obviously a bad thing. But these senescent cells are these cells that don't do anything except for cause toxic effects. So on both sides of the scale, whether the cells are overproducing or underproducing, they're both bad, and these senescent cells actually might have more to do with disease because all they do, and there's a lot of senescent cells in fat, fat cells. And so what all they do is they produce inflammation. They produce like chronic inflammation in the body, and they obviously are causing the other cells around them to be damaged. And there are some parts of the body that have almost, by the time you're like 50, 60, 40% of their cells are senescent. And so obviously that's going to be damaging to the rest of the body. So it's really interesting because that's it's kind of mind blowing when you look at it, that how important the mitochondria is to the body.
Yeah. So what are, so basically, so they start aging and for all these different reasons. And then so how does anti-aging, when we go to like, how can we reverse this?
Well, I'm going to go through it.
You're going to
Let's go
go
through the
all
last
the,
part, the
yes,
free radicals, right? You wanted to talk
yes,
about the free Okay. So why does
absolutely.
the
ROS.
so why does the free radicals occur? So what happens is if you like think about the mitochondria, and obviously I don't think a lot of people do, but I mean what happens is that there's a natural balance to producing ATP. And the natural balance is that the little little crests within the mitochondria produce a gradient of electrons and protons. I mean, just kind of a little in the weeds, but I mean, the point is what happens is that when the mitochondria become leaky, they start overproducing these electrons that leak out of their, cellular area, and these cause, an extra electron onto an oxygen, which produces these reactive oxygen species, which are the free radicals. Now, a lot of people thought like, oh, like in the 1960s, they thought that aging had everything to do with just production of free radicals, but they didn't know why these free radicals were being produced. And so now we know that even when they were giving patients like high levels of vitamin C, like all these antioxidants, they still weren't kind of getting the effects that they were hoping for because they weren't fixing the actual problem. The actual problem is the mitochondria is being leaking all these abnormal reactive species and causing these free radicals from being produced. So no matter what, they still can't catch up to the amount of free radicals that are being produced by the body because they're not fixing the major problem, which is the mitochondria being dysfunctional. And so you can fix these actually. There are ways to reverse this. And I'm going to talk about them. And I'm going to talk about a couple of studies that were done that look at this. But yeah, I mean, so the production of free radicals all have to do with the mitochondria. So when you hear that, like you hear that in all health food stores, they say free radicals, da da da.
Hmm.
It's all has to do with the mitochondria being dysfunctional. And so if we focus on fixing the mitochondria, like to the core, a lot of these problems will help to be and helped reversed, and will get make us healthier.
Well, I am very interested in what is the initial insult onto the mitochondria, where the dysfunction, is it sugar? Is it alcohol?
Yes,
Is
yes, it's
it,
a very good question.
is it environmental, or is it just like because your mother was sick?
No, it's an excellent question. Actually, what happens is that it's stress on the cells, and stress on the cells a lot of times we can define as in the insulin resistance, production of inflammation secondary to the sugar, not enough oxygen to the cells, meaning either environmental, poor exercise. It has a lot to do with the things that we do, in fact, that causes the production of the mitochondria being damaged. It's just overstress on the cells that produce it, and it becomes less efficient over time, and eventually the cells it starts to become damaged. And just as the mitochondria start to become damaged, they too are supposed to actually replicate new mitochondria, but they can't because they're damaged. And so just as they don't kill the cells that need to die, they don't fix their own mitochondria. So it's not being replaced by better mitochondria. It's being stuck in limbo. And these old mitochondria, just like the senescent cells, are sitting there as well. So that's the reason why we don't get the reverse. And what we need to do is we need to make an environment where the body is functioning at top capacity so it can produce more mitochondria, it can produce more functional cells, and also damage the senescent cells.
Wow.
Yeah.
Okay. That's um that's great to
So the
know.
question
Good to know.
now is, go ahead. I'm sorry. Go
That's good
ahead.
to know. How to stop this. That's all I am like. I'm like,
How to
this.
fix it. Yes, how to
Yes.
fix it. Well, I'm going to give you three ways to fix it, actually. So the first thing is that we need to have a more functional kind of way that the ATP is being produced, because again, a lot of studies are showing that in things like Alzheimer's, Parkinson's, they have found a lot of the markers of mitochondria damage. There are a couple of markers that they see. There's a marker called CD38, NAD50. These are things that are present when there's more damage to the mitochondria, and in the neurological problems, they find that these are higher. So they're able to kind of measure the fact that how much mitochondria damage are. So one of the major things that occurs is, so the mitochondria has its own chromosome, right? It has its own kind of DNA because of the fact it's own little cell. And so it communicates normally with our nucleus, our regular cell, and our regular DNA. And when that communication breaks down, that's what causes a lot of the problems, because our cells are like, our nuclear cells are saying, hey, we need more energy, we need more energy, but it's not getting the message to the mitochondria as we get older. And the one way to absolutely fix this, and they found that this actually worked, was increasing the production of NAD. So NAD is, for the most part, it's not necessarily a peptide, but it's more of a coenzyme. But it is foundational to mitochondrial health. And what happens is that, I think we talked about it in another thing. Every 7 years after the age of 30, your NAD levels go down by 50%. So by the time you reach the time that you're 50, 60, you have dropped your NAD by almost 70, 80% of the amount. And so with the decrease of NAD, what happens is that they don't communicate. The nuclear cell and the mitochondria no longer communicate. So it causes a lot of the problems. It's like, and somebody explained this, like, at the beginning of marriage, you have, like great times, great talk. And then kind of like as time goes on, you stop communicating. And of course, this starts to become toxic to the marriage, right? Same thing happens as for these cells. The mitochondria, it's in its own little place. It's building energy. The cells say, hey, I need more energy. And the mitochondria says, yes, dear, I'll get it for you. But then over time, it starts to say, I don't hear you anymore. What are you saying? And this actually causes the whole process to to be dysfunctional. But one thing that can reverse this, and they found that the adding NAD to the system actually is key to actually creating this communication between the mitochondria and the cells, and that's the first way that they proved this. That mice with Parkinson's disease, they found that there was a major damage, and then adding the NAD actually improved their cognition, their function, as well as their endurance as well with just adding NAD. So that's the first thing, which I know we talked
So
about
how does NAD, like, where does it act? I mean, is it NAD is like what, a booster? It's like an energy
So if you
booster.
look at I don't know if you have the slide on the Krebs cycle I sent a little while ago, but I mean, so if you look at any slide on or any like thing on the Krebs cycle, right? If you
I'm
look at
finding a
every
Krebs cycle, Kreb. Rose, can you look
or
up
the
Krebs cycle?
citric acid
Yeah,
cycle or the Krebs cycle,
yeah,
either one.
yeah.
So
Pull
so
it up.
what so if you look at that, like that's how our entire cellular metabolism works. And without NAD, it does not work. It's just so you need two things. There's two things that you absolutely 100% need to produce ATP. And the first thing is oxygen, right? So when people work out a lot, right, they end up getting this burn because they're producing lactic acid, and they're producing less energy because of the fact that they don't have the oxygen that they had before. The second thing that is more foundational that no one thinks about is NAD. And without NAD, you normally from one glucose molecule should produce 38 ATP, right? So that's kind of like the standard amount. But without energy, without oxygen or NAD, for every glucose molecule, you're only producing 4 ATP. And so what that means is that we are less functional, we are less efficient, and our bodies understand that. And so NAD is foundational for everything as far as for energy, for the mitochondrial function, as well as the mitochondrial health. So this is, absolutely important. If you go through, I don't know if we have the slide, but either way,
I don't know if she was able to
that's
find it.
fine.
Let's
It's
see.
fine. I mean,
Yeah,
we
well,
we can like we could look at it another time, but I'm just saying that if you look at
yeah.
it, you could Google it, look at the
Uh-huh.
Krebs cycle, you'll see
Yeah,
that
yeah,
NAD really
yeah.
has everything to do with cellular metabolism. There you go. Perfect.
Yay,
You found it. So now look at
yay.
that. So if you look at it, at least if you look at like the little kind of circles on the around the Krebs cycle, you could see how many times NAD pops up on that. Um,
This cycle has given me palpitations in med school.
yes, yes, exactly. But now
The
now
same.
we're using it.
This
Now
is
go.
this is this is causing trauma. So please,
This is causing trouble. I
it's
actually
reminding me of my
I
prior
actually
past
majored in
trauma.
cellular biology, so it was like very
It aged me by 10 years just by looking
yes,
at it.
yes, yes,
Okay. So
yes. So if you
it's
look at
creating, I need NAD just to look at it.
yes, you do. But now I want you to look at the circle and how many times you see NAD kind of on that like little it's in the little kind of like side panels because that
Ah.
without it you can't get to the next step of cellular
I
respiration.
think NAD is like cash flow in the body.
Yeah. Well, I
It's
mean the
like cash
whole
flow. What you want to make this material from this material, give me more cash. And
absolutely.
give it, it's like as if the body is paying, as if the body is paying the mitochondria to create the next product.
Absolutely. Yeah, absolutely. And without it,
Wow.
so without NAD or oxygen, so those are the two things you need. And without either of them, you are less efficient. You are going to be tired. You're going to produce more inflammation. You're going to have like you could see that patients who have decreased NAD, they went post like post heart attack and things like that. They have less efficiency because they've done studies where they actually gave NAD to animals that had heart attacks, and they saw that they had less chance of actually producing cardiomyopathy, or heart failure because of the fact that they are able to repair better. They're better functional when they have more energy. Because without energy, none of this stuff works. So your immune system, your brain, your heart, everything has to do with having enough energy. And one of the major things of aging and sickness is energy deficiency. And I talk about this a million times. And NAD is like a foundational. Everybody should be taking NAD every single day. Like, I mean, they don't have to take it every day, but they should be taking it every week, I should say. You should be like filling up your tank of NAD every week because of the fact that without it, like everything, including your mitochondria, are not going to be as functional. And I
So
understand, I'm sorry, Dr. Din, for giving you this trauma this morning of having to
no, no,
relive
no.
it.
This is
No,
not
I'm
trauma.
kidding.
This
I'm
is
joking.
not.
I'm joking.
It's somehow it's not
It's not as
sounding
traumatic.
that traumatic because I think I
Well,
don't
I'm
have
going
to
to
take
test
an
you on it
exam
later,
at the
so
end of
maybe.
it. I think maybe it's because I don't have to take an exam at the end of it, but I
Yeah.
have to like truly understand. However, I sometimes feel that because it is a energy booster, like who are the people who should not receive NAD, for instance? And what is the best way to get NAD? Because we also fear that if you give NAD to somebody who has cancer, for instance, brewing in their system, this is just a booster. It's going to just boost those cells too, no?
Well, I mean, obviously, like these are the things that this is why
Fine tune it.
yeah, we fine tune. We look at every
Yeah,
patient as an
yeah,
individual.
yeah,
So when I say that, obviously every patient is individual, and I'm trying to kind of give you a broad brush of saying that,
yeah.
hey, like this is something that like a good majority of people would benefit from because of the fact that when you think about what the foundation of all these problems are is energy deficiency, and so we know that we become less resilient, we become less less efficient, and inflammation and energy loss are two of the major things that cause this, and they're both linked to not having enough NAD. So yeah, so that's the
Yes,
first thing for sure. um so that's why like I said, NAD is really foundational to help any kind of mitochondrial dysfunction. But the second thing that we have to understand is that there's something in the body. So we know that the mitochondria has its own DNA and chromosomes, and so because of that, it actually makes its own peptides, which is actually very cool. And they are able to actually isolate some of these peptides and what they do. And the second one I'm going to talk about is something called MOTS-c. So this is a small peptide in the body, but extremely powerful. And what does it do? So MOTS-c is a peptide that there was a study in 2018, and what they did was they had two mice, right? And one mice they fed like really bad food. They fed bad food, high fat, high saturated fat, really like American diet, like to these people, like American chicken wings, and like to these my I don't know what
burger,
they fed. Yeah, burgers, chicken wing. I don't
fries.
know what they fed them, but I'm
Yes, yes.
being. But so
My
they fed.
favorite food, you mean, in
Yeah,
other
yeah,
words.
yeah. So they fed these high fat diets to these mice, right? And so they grouped them, and they gave one group MOT-sc, which is this peptide that comes from mitochondria. It's like specifically a mitochondrial peptide, and they gave the the other mice placebo. So the mice that got placebo became fat, lethargic, tired, fatigued, very inefficient. The mice that got the MOD-SC actually were normal. They didn't gain the weight. They didn't become less efficient. They didn't gain fat in their muscle. And so this was a really interesting study. And so if you kind of like figure out why is this, like what does MOTS-c do? So when your body thinks senses, like your whole body, it's smart, but it's not that smart. You could trick it. Like by doing exercise, the body is like is thinking that it's in stress mode, that it's like losing energy. It's got to break down whatever it can do to build energy. This is why exercise is so important because your body is getting the stress and it's saying, hey, we need to break down fat. We need to do things to stop this, like because the body starts thinking that, hey, we need to make sure that we don't like fall apart by lack of energy. So it goes into this cycle called AMPK. And so what AMPK is that means that your body is saying, hey, I need to break down whatever I can to build more energy and get the sugar out of my system and into the muscle because we're losing muscle quickly. We are losing energy quickly. And so this is actually a great thing because it makes our body more efficient. So the AMPK pathway, what it does is it builds muscle, it decreases fat, it actually takes the fat out of your system and it uses fat to break down to build more energy, and it takes the sugar out of your bloodstream and it puts it into your muscles. So all the positive things that we want to do. And this is what the thing is that when we exercise, we produce a ton of MOTS-c. And what MOTS-c does is this. It actually causes all these effects: decreasing fat, increasing muscle, increasing energy. It produces tons of new mitochondria because your body is going into this mode where it's saying, hey, we need to build more energy. So this peptide is incredibly important for our
Are
bodies.
we on the right slide? Because I where is Mott? Because
I don't
I
know. I don't know if
this
they
is a
have this one
oh, we
on.
don't have the
I don't know if they have
correct
it.
slide.
Yeah.
Let's see. Um,
But I'll just go
yeah, yeah,
through it. I mean,
yeah,
the
yeah.
important thing to understand is MOD-SC, even in these mice that were being fed this high fat
Mhm.
diet didn't gain weight. And so
I
think about
see.
it, if you are doing all the right things and you're
Yeah,
taking this peptide, you're
yeah,
actually going to lean out, build more energy, decrease decrease insulin insensitivity because it's taking the sugar out of your bloodstream and
yeah.
putting it into the muscle, and decrease inflammation. And the
So
other
who
thing,
creates it? So MOT-SC is the peptide.
the peptide, yes, MOD-SC is produced by the mitochondria. And it does
Mm.
this because it's saying, hey, we are energy deficient because something's happening, something's wrong. And the thing that's wrong a lot of times is we're exercising. So the
Yeah.
body's like, hey, like we need more energy. We need to produce more ATP. So it starts burning fat to do this. And so this is a great thing. It makes our body more efficient. So this peptide is like, the furnace that actually burns down, all our fat cells, and it causes our body to actually go into thermogenesis where we're actually building more muscle, decreasing fat, and actually building more energy because it builds more mitochondria as well.
Wow. So
Yeah,
it can be produced just as a result of exercising?
that's exactly.
Oh,
Exactly.
wow.
So,
What
so if
else?
you so if you exercise, yeah, well, I mean, that's the major thing. That's the major thing
Uh-huh.
that they've done studies where they've done biopsies on muscle to see how much MOD-SC was in the system after they stressed, like stressed animals, and they found almost a tenfold amount of MOD-SC in the muscle that had exercised. And that's what it does in our bodies as well. When we exercise, we produce a ton of MOD-SC. And so, but what it's doing is it's all the positive effects of exercise. But if you take it, you're doing this, and you should be exercising as well because you enhance the effects. But without exercising, you're getting all the positive effects of
Oh,
exercise.
really?
That's why they call it exercise in a bottle.
Are you telling me that I can escape
No,
exercise?
no, no. I didn't say that.
You just made my
I,
day. This
yes,
is
no. It
like,
does. It does.
wow.
It gives you
All
all
I
the
have to do
positive
is like a little
effects.
shot and
Yeah,
I'm
yeah.
good.
Well, I mean,
I think a
I mean,
lot of ladies, and I know a lot of people who might be interested in it.
yes, MOTS-c is exercise in a bottle because
Oh,
that's what it's doing. It actually is causing the same metabolic effects of of the exercise with the peptide, because that's how it actually occurs, because the peptide becomes overflows the system when you exercise, and it goes into this AMPK, pathway where it breaks down fat, builds muscle. For the bros, what it does is it actually inhibits something called myostatin. And
oh,
myostatin makes us stop building muscle to a certain point. So when you have a lot of MOTS-c in your system, it actually inhibits that, so you can actually produce more muscle. So that's
wow.
that's for the bros,
That's for everybody. We
that's for
all need
everybody. Yes.
muscle. I
Yeah.
was myself, I was thinking that what am I going to do like in the next couple of decades? Do I
Right.
really need to buy myself an M sculpt or something?
Yeah. No. 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 Just take your
Just
MOTS-c.
mod SC and goodbye M sculpt? I don't
Yeah.
really need to spend $500,000 on
Yes.
purchasing
Yes.
that machine.
Absolutely.
Oh
Yes.
wow. Wow,
So
that's very good news. I'm gonna like really look this up.
so then the third one, the third peptide I'm going to talk about is we're going to
So
talk
first
about.
was NAD, second is MOT-SC.
Right. And the third
Wow.
one is something
You're
called,
changing my mind about NAD because I am like so worried about
I mean,
prevention of like
NAD,
cancer and
NAD
stuff.
is foundational to our whole energy. I mean, I think that NAD honestly is one of the keys to like anti-aging, health, and just in general, like your energy, your whole. So I do think that NAD really is something that you should relook at, honestly, because NAD I think is kind of foundational to everything, because
I
it
got
really it
spooked
supports.
by NAD.
Yeah, I know that. I mean, there's a lot of like you have to be obviously cautious with everything, but I mean, I do think that a lot of our health problems come from, like I said, mitochondrial dysfunction, and without NAD, you're not going to improve it. So you have to work to increase your energy levels to be able to do that.
Okay.
But of course, everybody's different. We're not giving medical advice, over this podcast, but we are, discussing like what things might be beneficial to some people. Of course, they should be working with somebody like yourself or myself to kind of make sure that what they're doing is the right for them.
Yeah, yeah.
The third
So
thing is,
NAD,
go
MOT,
ahead, honey.
SC, how much,
Yes.
how often do you need to take MOT, SC?
So the MOTS-c, I take it twice a week, for the most part. I take the NAD probably once a week. So it's not like it's every day. So these are peptides that you don't have to take every day.
I see.
The third one is more of a cycle peptide, but this one's a really interesting one. This one's called SS31. And I didn't name it. I'm just telling you what it is. And so what
They are
SS30,
very unimaginative
yes, very, yes,
names
yes.
because
Yeah.
it's like just
Yes, you would love it to be
we are
like,
rewriting pharmacopoeia because when I was going through pharmacology,
well,
I was like, who named all these medications? We need to
right.
like, you know, we need new names.
We
But
need new
yes,
names, and
please.
maybe we can work on that. Maybe we could start renaming these things.
SS31.
SS30.
They have some really nice. I was looking at some. There were doctors who were selling these stacks of
Mm-hmm.
peptides, and there
Mm-hmm.
is a stack called Wolverine stack, which
Yes.
is like for
Yes.
repair and stuff. Then there is like an anti-aging
Yeah.
stack.
Yeah.
There is
Yeah. We
like a
work with
glow stack, like the
Glow,
glow stack
Glow,
and stuff.
Wolverine. Yeah, we
Yeah,
work with
so
them.
it's so I think that we're doing a little better in naming them because
Yes.
humans have to understand what are we trying to tell you to take. So
Right.
this is like a
Yeah. So Mott
it's a
SC.
message to your system that to create something for itself. So how like okay, take NAD, MOD SC, and SS31. They'll be
Right.
like,
So
what?
Mott SC, you could say like they call it an exercise of medic. Essentially like
Yeah.
exercise in a
Exercise in
for,
a bottle is I'll never forget. I'll be
yes.
like, Give me my exercise in a bottle, and
Yes,
that's
yes, yes,
all that I need.
yes, yes, yes. The third one is SS31. So SS31 is a little bit different than the other ones because SS31 actually is kind of the repairman of the mitochondria. It actually works on the foundational crescents of the mitochondria to make them less leaky, more functional, and more energetic. And why is this important? Because what I told you earlier is that the reason why we produce these reactive oxygen species or free radicals is because of the fact that the mitochondria becomes leaky. And so when that happens, that causes obviously damage to other cells, damage to the DNA, decreased telomere size. So all these things that are producing free radicals in the body are because of the fact that the mitochondria itself, the integrity of the mitochondria itself, are being damaged. And so SS31 is completely different than, and people get this confused, and I'm gonna explain this. MOTS-c and SS31 have very little to do with each other, but they obviously both work on the mitochondria. They're both mitochondrial peptides, but a lot of people think that you have to take one and then the other, and the fact is you don't. MOTS-c can be taken on its own without anything else, and you don't have to take the SS31 because of the fact that it's all about like the functional ability of the mitochondria. And so with MOTS-c, you're producing new mitochondria. So it's not that as important, but to prevent free radical production, to prevent inflammation, to prevent the mitochondria from becoming dysfunctional, the SS31 peptide is very powerful for this. And they're finding that, in studies with patients who have pulmonary fibrosis, patients who have CHF, they're giving them this SS31. They've done studies, and they're finding that they're finding improvement with these types of diseases because of the fact that a lot of it has to do with the damage, the dysfunctional, and the free radical production of the abnormal mitochondria. So SS31 is kind of like the third plank, but it's an important one. You don't have to take this all the time. You take this, to help, overall dysfunction. But I mean, it really is important to help kind of the integrity of mitochondria. And it definitely, they found that giving patients SS31 has decreased the production of free radicals by almost 30 to 50%, in a lot of cases in animal studies. So
How
that is
often do we take this
so the mod
SS31?
so the SS31, this is a 5 day on, 2 day off, but this is like a 4 week, 4 to 6 week like cycle. That's all you need to do. You don't have to do it, like for longer. You shouldn't have to recycle it. This is helping the repair, but you could do it for a month to 6 weeks, and you take it 5 days on, 2 days off, for that cycle, just to help kind of give more integrity to the mitochondria and give it a better functionality and less free
Cycle is
radical
once a
production.
year, or
Yeah, 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 yeah. I
okay.
mean, for a lot of people, a cycle you don't have to do for like once. This one, some of the peptides I'll cycle, 2, 3 times a year, but this one specifically, you could do once a year, and it's a good kind of foundational way to help, the functionality and also to prevent the free radical production. So this is really the cellular way to stop taking the vitamin C, the vitamin B. I mean, I'm not saying you shouldn't be doing these things for certain things, but a better way to actually stop free radical production is to actually stop the production of it by the thing that actually is causing
Yeah.
it, so
Yeah.
actually fixing the
It's like
problem.
cleaning the factory,
Right,
cleaning
exactly.
cleanup of all your factories, deep cleanse of all your factories once a year in a
Fixing
6 week
fixing
cycle.
the fixing the pipes and the
Yeah,
plumbing.
yeah.
So
Oh,
you just
maintenance, the maintenance service staff is
That's
coming
right. So yeah, so
every year.
SS31 is important for that. And so with these three peptides, a lot of the problems, like I said, that we have, I do believe originate from the mitochondria being dysfunctional, being less efficient, and also just being less present in our bodies. We produce less. And with this, by adding, NAD, MOTS-c, which I mean, I love MOTS-c. I think it's like one of the coolest,
I'm
peptides out
ordering
there.
it right now. I'm like
Yeah,
right after I finish, I'm like
yeah.
buying myself this exercise in a bottle.
Yes, yes. And the SS31,
Yes.
all three of them, are very important for, our overall mitochondrial health, and our overall energy, and
How do you check as like is are there any blood tests that we need to monitor with this, or is there like any with these peptides, like what do we
so I mean you could
any
certainly
markers?
so you could certainly look at a couple of there's a couple of things to look at how our mitochondria function. You could look at lactate, you look at pyruvate, you could look at a couple of markers called there's one called GDF15 and there's one that's called FGF2, and these are all kind of are indicative of mitochondrial dysfunction. I mean, there are other reasons why these some of these levels are higher without mitochondrial dysfunction, but putting them together, if you see a pattern of these specific markers being elevated, you could confidently say that there is an increase in mitochondrial dysfunction. So you could look at this and then, add the peptides that you're using and see the change in, the change in these markers to see is there decreased mitochondrial dysfunction. And I mean, like I said, with MOTS-c specifically, they have done like human biopsies on people and saw the large amount of percentage by just going on the Stairmaster, the
Mm.
amount of MOTS-c that shows up in the body from pre-workout to post-workout. So, by adding it, to your system, that is something that's going to be effective, for the system. So,
So now, like, I wanted to ask a question, like, for people who may be listening and interested in starting this journey into peptides. So if
mm,
somebody is like, let's say 60,
yeah,
let's take a sample, like a 60-year-old man and or a 60-year-old woman. Like, so
yeah,
what are we? And if they're like they have never done anything, and here they are right at the tip of the edge and about to keel over into some kind of problems. So
right,
what peptides do we offer them for this man first? And like how many peptides would you think? I mean, and like this is like, let's say a standard person not who's like their hormones are tanking, so tanking, so we're going to talk about hormones later, but like just peptide wise, what would you start like a 60-year-old man with a who's in perfect health, doesn't have
right,
any issues, and a 60-year-old woman who also is in perfect health, doesn't have any issues except for the fact that they think that they're about to explode.
right.
There's
So
a
yeah,
check engine light
it
is on, but they don't know
yes,
what it
yes,
is. It's
yes.
not on the blood.
Right.
Nothing
Yeah.
shows in
So
their bloodstream.
right. So like the hypothetical patient that you're talking
Yes,
about, obviously
yes,
everybody is different and we're not
yes,
going to
yes,
diagnose and give
yes,
recommendations to everybody. But in
yes.
that type of person, yes, I would say like NAD would be, incredibly important to these type of patients because besides for the fact of energy, besides for the fact of inflammation, there's a lot of data that shows that NAD and cognition, like brain function, have a lot to do. There's a big kind of proponent to how NAD affects the brain, and that you find that patients who go on NAD increase cognition, increase, like executive function, increase the ability to kind of recall just by taking the NAD itself. Besides for the fact that I always feel that, increasing your efficiency of ATP production is uh, no matter what age you're at, is important for repair, for recovery, and just in general, like not falling asleep at 2 o'clock in the afternoon, after you had, like only 4 hours, 4 hours post sleep. I mean, so obviously, I think NAD is something that, in that hypothetical patient, would be, absolutely first recommendation. And then also, like, yeah, I mean, I think MOTS-c is another one that I think that, because of the the overall effects on most patients, in our country, because of just, standard environment, diet, things like that, you start losing muscle, you start, gaining fat, you start kind of not being as efficient as you once were, and you can't exercise as much because of the fact that you're having trouble recovering, as we get older. So it's harder to like go to the gym and kind of get to that point. Something like a MOTS-c would be an absolute, like great peptide for them because they're going to gain energy, they're going to gain muscle, they're going to lose kind of that belly fat, that kind of midsection fat. They're going to decrease the amount, they're going to increase their lean muscle, and they're going to increase their mitochondria, which is one of the major problems that we have. NAD itself doesn't produce more mitochondria, but what it does is it makes the mitochondria more efficient. MOTS-c actually increases the number of mitochondria in our bodies, which is actually, of course, going to make sure that we have more, like furnaces to be able to produce energy. And so that I think is, like so important because as we lose that mitochondria, that's really important. I think that, over time, like we would see, like maybe SS31 would be kind of later in the game. But I mean, I think that those two peptides for sure on this specific topic,
Mhm.
absolutely 100% would give to those
What about
patients.
GLP? Would you put them on a GLP?
I mean, I think that again, my affinity to GLPs. I think that, especially the GLP-3 retatrutide, which is the most kind of advanced GLP we have, is very important because this, together with helping your mitochondria, what it's doing is it's helping your metabolic effects. So yeah, absolutely, because what the GLPs are doing is they're making um, your insulin sensitivity more pronounced, but also it's making you leaner, it's making you, healthier. And there's a lot of evidence that show because of this insulin insensitivity that so many people have, at ages 40, 50, 60, it's affecting all parts of their health. And so, yeah, I think that, GLP, whether it's GLP 1, 2, or 3, GLP 3 being the best because of the fact that what it's doing is it's not only doing all the positive metabolic effects of 1, 2, and but it's also with glucagon, it's allowing the bodies to protect muscle and burn fat more efficiently. So yes, I would say GLPs, absolutely. I think that the growth hormone analogs that we talked about last week, I think are absolutely incredibly important for our patients. But again, it has to be the right patient to do it.
Is that
But
you can give it to somebody who doesn't have
definitely.
any issues, or just like you can just
100%,
give
100%.
you
The
can give it as that?
tesamorelin, 100%, yeah. Tesamorelin, because again, that's working on the metabolic effects, but also it's really valuable for patients to, for their cognition, for their overall kind of health, decreasing cholesterol, decreasing their visceral fat. I mean, these are all things, again, everybody's individual, so you really have to kind of look at them, but
Yeah.
looking at the average person, in the at that age group, they're going to have these issues. There's a large percentage, not all, but a large percentage of them do. So I would say that, yeah, GLPs, growth hormone analogs, MOTS-c and NAD, absolutely. And then, of course, you could add the glow. So it
Yeah.
depends on each person. Is
Glow to
different,
the
but
woman, I will for sure give.
yes, yes. I mean, glow is pretty
Glow
much.
up is
I
a
cannot keep it in my office. Honestly,
it
I
just
run out of
flies
it
out. It
every
comes in
week.
and it flies out right
I
away.
run out every week,
How
and
many how many of these peptides are FDA approved or awaiting approval?
so, I mean, for the most part, the great thing that just happened is that, a lot of the peptides that are kind of like sitting in, FDA approval lists have been taken off the kind of negative lists by the current FDA, like just recently. So 20 peptides that were on the kind of questionable lists by the FDA have been taken off that list and are allowed to be used now. So there's the studies that are being done with, I think NAD definitely. There are some studies with MOTS-c as well, and even SS31. There are really interesting kind of studies of things that like we have no answers for in medicine. Like I said, the pulmonary fibrosis studies that are being done with the SS31. I mean, they have shown that patients who have pulmonary fibrosis that literally can't walk like 30 steps without getting like out of breath and having to sit down. They found that these patients who are received SS31 actually are walked almost double the amount that they did with only a small amount of the SS31 already with patients with pulmonary fibrosis. And as well as, there's a lot of studies that are showing that patients who have early cognitive problems, pre-Alzheimer's, pre-dementia, are improving their executive function, improving their ability to think clearer, recall better, are doing much better on all these regimens with adding NAD. So the studies are out there. The great news is that they're no longer on this list where that they're getting it from the back alleys. That the FDA said that you should talk to your physician, you could talk to a licensed practitioner about working with peptides, and now they've cleared the deck for us to use them. And it's incredibly exciting. It's an exciting time because I think that we're kind of like right there. We're right on the cusp of realizing that like letting our bodies function better and be more efficient is the way forward, as opposed to waiting for something to malfunction and then throwing a drug at it. So,
Yeah, no, it is a great step forward and a progress in medicine where you see some of these health supplements categorized correctly because
mhm,
I consider them a supplement. I think that these are the supplements our future generations are going to be just taking
right.
regularly anyway for just promotion of their health. And the more data we have, the better it is going to be for our kids to try. Because, unless FDA authorizes physicians, then it will be hard to even try these. One comment I have to make is about the GLP-3 ritutrite. I just was reading an article on this thing where the pharmaceutical industry is trying to take the preparation of GLP-3 under the premise that it's not a peptide, but actually a biologic
Biologic.
because it has not 39 chains, it's not 39 amino acids, it's like another like if there's like I think an extra
Amino acid.
amino acid in it, and that's the reason that it kind of is classified as a biologic. So there is like this tug of war going on, which
Right.
means that if GLP-3, which is the best of all of these, gets taken over by another pharmaceutical giant, just like Wegovy and Ozempic and Mounjaro and Zepbound have, then this is also not going to be easily and cheaply available, just like the rest of the peptides. And it will just become like a very expensive add-on to our
Designer, yeah.
supplements.
Right.
So I think that I don't know who's gonna take that bite away from the pharmaceutical, and they're not gonna
Yeah,
leave it. There's too much money involved.
there's a lot of money involved. But yes,
Yeah.
I mean, these are the things that like that we deal with in this arena. But I mean, while we have the availability and while we have, like some sanity and kind of like like looking at the health effects of these peptides, then I mean, we're going full force. And look, I mean, we've had a lot of issues, over the last few years with the GLPs, honestly. And we've endured, so we'll keep
Mhm.
going.
Yeah, yeah, no, well, thank you. And what are the things that we need to look for? Like who would not be a candidate for these supplements?
Again, each patient is individual. Obviously this is like not medical advice for the people that are listening, but I mean it's information. But obviously, any patient that you're, like have concerns of, cancer, any concerns of certain things. I mean, there is something, to the fact that patients with type 1 diabetics, like that are not making, the not making enough insulin on their own. You have to be cautious with these patients too, because some of the peptides that we're giving are so efficient that we might be potentially causing harm to these people. It's not clear that that's the case, but it's something that I think about, because of the fact that, type 1 diabetics are very specific, a specific class. They're not like the majority of patients who are type 2 diabetics do amazing on these peptides. But type 1 diabetics are, patients that have lost the function, lost the ability to produce insulin. And so making them more efficient might, be potentially harmful to them. So I think that that's something that you have to look at, and that's why each patient, has to be, like looked at clearly by, a healthcare professional. It cannot be done, haphazardly,
Do you
because of
think
the.
AI will be able to prescribe, an AI doctor will be able to check blood work and prescribe relevant peptides?
Well, I'm going to tell you a funny story. This is completely off topic, but I just thought that's an interesting question because so I had a case in the emergency room just a few nights ago, and it was a very strange case. I'm not going to go through all the details, but there were a lot of lab abnormalities. The gentleman came in with healthy guy who came in with a fever prior and had all these very strange lab abnormalities. And so me and a colleague, another ER doctor, we were sitting there talking about the case and we were trying to like put it together in our head, like, how does this all fit? And there were certain things, but then it didn't fit with other things. And so I was like, let's put it into AI and see if it comes out with the answer, then I will quit medicine. This is what I said. So we put the entire case into AI to see if it was going to come out with, oh, it's obviously this. It didn't. So, there's still hope for us, Dr. Jen. So it didn't
It
come out with
didn't.
the end. It did not. It came out with the
Um,
same things that we were talking about. It could be this, could be that. Like there's,
yeah.
so it didn't come out with like the definitive diagnosis.
Yeah,
I was a
AI
little nervous.
can't be as good as somebody who has experienced
Right.
healthcare and physical work and cracked, codes over 20 years or 30 years. That's impossible as of yet because AI is still like what, 3 years old?
Yeah, and it still comes from the information that is given to
Mhm.
them by the people who are sitting there, like actually looking at this stuff. So, I mean, I think that, that gave me a little, it gave me a little smile, knowing that I wasn't like, and it was another, like seasoned ER doctor, and we like were talking about this case like for hours, like, because it's such an interesting case. And I was like, well, let's try it. I mean, we can't come up with like a definitive answer. Let's see what it says. And so it didn't. So thank goodness for that. I feel better.
Very good. Yeah.
Yeah.
No, I
But
feel better too for some reason. Like for now, today
right.
at least it didn't reach. How long was this? Because I think that quantum computers are already here.
Yeah. Yeah. I mean, it was like one of the
Yeah.
whatever. I don't know which one
Yeah.
it was, but I mean, it did not. I gave it all the data, the same data I
Yeah.
gave to every specialist I talked to on the phone, and
Nice.
I let it kind of like you know make a decision, but it didn't come out with a single diagnosis, so I was happy about that.
Well, okay. Now, so does that mean that? But the thing is that, see, maybe AI may not be able to crack the disease management system
Right,
because by the time humans are falling apart, so many systems are collapsing at the same time
right.
that it can be very hard to manage. However, health and supplement side of the healthcare, I don't know. I mean, maybe it that would be simpler, and AI can be an anti-aging
Well,
concierge.
it has to have the information too, and the
Mhm.
whole thing is like you have to have trailblazers like yourself, like myself, to be able to
Yeah.
actually look at this stuff and say, hey, this makes sense or this doesn't make sense because the information it's getting is still from traditional sources. And
Yeah.
so I don't know, who knows that, I don't know in the future, maybe that will change, but right now it doesn't have the same kind of like critical thinking that I think that, people who
Thankfully.
are, yeah, yes, that are looking at this stuff and saying, even though that this study hasn't been done yet because no one's funded it, that doesn't
Mhm.
mean that, this doesn't exist or this doesn't help. So,
Yeah. Yeah. Well, thank you so much, Dr. Frankel. We are not done. This is just like another episode, and we're gonna come back, and this time I'm gonna make a list of all the peptides and
okay,
all the different stacks that are
okay,
currently available. And like maybe if we can go over the stacks and what are the potential side effects, what are the potential benefits, and um who should benefit from something like this, and what are the cost, like what would a stack cost,
right,
and are do these peptides need to people should carry, like I think every person I know will eventually have a little peptide refrigerator which would
yes,
just carry their peptides, and they
yes,
would give it to themselves every day, or like
absolutely,
whenever it's done.
absolutely. I mean,
It's like groceries.
it's in my refrigerator, actually. It sits there, and I have all my peptides, sitting in a little kind of case. It's a really nice case, actually, and someone gave it to me, and it's easy to pick up. It's just like you're brushing your teeth in the morning. That's what I say. Like
Wow.
it's the
That is
same kind of
amazing. That is amazing. Well, thank
yeah.
you so much. I look forward to my next class already because we're going to go through all the stacks.
Thanks.
And are there stacks for adolescents and kids also? I have like already I'm telling you a question because I'm sure I will be asked because
That's
the young people are really interested in this. I'm much more
absolutely
so than the than the senescent population.
Yes, yes, yes. Yes, yes, for sure, for sure.
Thank you,
Absolutely.
Dr. Frankel, and I hope to see you soon again. And I'm hoping that next week you'll come and give me another part of this.
Absolutely. Of course I will, Dr. Dan. It's my
Thank
pleasure as always. You have a great week, and
Great
we'll see
week.
you guys soon. So,
Thank you. Thank
all
you.
right. All right.